Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt, your live streaming host, and with us is Dr. Payne. And today's topic for Ask Dr. Payne is does a mommy makeover include a BBL or Brazilian butt lift? Dr. Payne, maybe you can take that question and let us know what that includes. And also, for you folks just tuning in, we'll be checking the YouTube channel. If you have a question, please let us know. And if you happen to miss our live stream here, just leave a comment, and Dr. Payne will follow up with his best opinion and advice. So, Dr. Payne, please let us know what you think about that one.
Yeah, that's a good one actually, because BBL or Brazilian butt lift is liposuction and fat transfer to the buttocks. And a typical mommy makeover is some kind of breast procedure and then generally a tummy tuck. Um, Now, to do a BBL with a mommy makeover would be doing some kind of breast surgery, then some kind of tummy tuck, and then liposuction and fat transfer to the buttocks. I would say it's not a routine combination, but it is possible in some circumstances. And what I would also caution people about is it isn't something to be taken lightly because you're talking about a fair amount of surgery. So if you're talking about somebody who, let's say their hemoglobin isn't the greatest, maybe they have medical issues or their age is a little higher or their BMI is a little higher, I think combining all three can put you into a tricky situation. And I don't like to see that because sometimes we see stuff in the news said, oh, this happened here, there, and then they make it seem like the plastic surgery itself is unsafe. And then when I read those articles, I find, well, I'll look at the details and say, well, yeah, of course, this shouldn't have been done in this particular person by that particular surgeon. So it's not surprising that something went wrong. But I have done this combination. When I will offer it is when the BBL, we have a combination rule. If we're going to do lipo, fat transfer at the same time with another procedure, it's a maximum of 1,000 cc's. So that's 500 cc's per buttock. So that's good for somebody that's got a smaller amount of augmentation that they need. Maybe it's only the lateral, or maybe they've had a BBL before and they just want to enhance it a little bit. So those are going to be patients that can do that. And if the breast procedure isn't that extensive, maybe the lift is rather small, or maybe it's just implants, augmentation alone, same thing. So like everything, we'll assess somebody and give them, our opinion. And in most cases, if it's able for them to do it safely, we'll offer it because I'd rather see us do the surgery than have it done by somebody that maybe shouldn't be doing it, or they go to a foreign country where who knows is doing it and something happens, So we'll take a look. And if it's possible to safely do all three, we will offer it. In general, though, it's a little tougher to recover from because when you have the BBL and the breast and tummy, you got to sleep on your back. Not really, because you get the BBL, you can't really sleep on your stomach because of the breast and tummy surgeries. So people have to sleep side to side. It can be a little uncomfortable. Most of the time, what people will do for this kind of thing is they'll either do the BBL first, especially if they're looking to get pretty strongly enhanced. Then you can put, we can take out up to 4 liters of fat. They'll do that maybe first, and then they'll come back for the breasts and tummy tuck. Alternately, sometimes the breast and tummy tuck are more of their priority, and then they should do that first. Then they can come back and we can do the BBL later. The only time that becomes tricky is if someone has a limited amount of fat, and they may be better off doing the BBL first because when you do the tummy tuck with lipo, you're going to be lowering the fat available. So we'll give an assessment of what we want to do it in the order that you want to have it done. But if we think that order will affect the second procedure later, we'll let you know up front so that you can take that into consideration when you make your decision. But a lot of times, this can be combined in the select patient without any problems. But it isn't something to be taken lightly or just say, oh, I'm just going to do this, no problem. Because if someone has medical issues or a lower hemoglobin, they can get into more trouble, more likely with that larger combination procedure than with smaller procedures or procedures only involving one anatomic site. So hope that helps clarify it.
Thank you, Dr. Payne. And if you have a question for the doctor, please leave your questions and comments in the comment section of the video. And also, feel free to visit Dr. Payne on Instagram, Facebook, soon TikTok, and of course the website and YouTube. Dr. Payne,